my career would have been over.
I'm very grateful every day.
I am still in the Army today because of the surgery.
The Fort Knox TeleNeurosurgery program is an innovative project that links valuable resources at Walter Reed, the neurosurgery department, to Fort Knox's MTF. Most MTFs don't have neurosurgical services available on post. So with this program, we're able to offer that to the soldiers here. That's very important. They're able to not only get their conservative care, their physical therapy, their chronic pain management, their pool therapy here on post, but now they can also access that neurosurgeon. They can get the care that they need without having to leave their home environment. When you're recovering, you need to focus on that. The thought of having to get into a car, drive somewhere else, wait, or deal with people that you're not familiar with or might not be familiar with the military system is a problem if you're trying to heal.
I believe that I'd received the best care here on post, receiving it from actual people who were associated with the military, had been part of the military and still are part of the military, soldiers helping soldiers. I do believe I've received the best care available to me here on post.
I truly enjoy the fact that I just one stop. I didn't have to go all over Kentucky to figure out the different specialists and different people. So I enjoy the fact that it's like a one-stop shop. You get everything done and not have to travel all over.
To have a program like this in as close proximity as Fort Knox here at our Ireland Army Hospital, that right there, it was enough to make your head spin. I mean, first of all, I'm frustrated. I didn't know, exactly how things were going to work out, but now to have a program that pretty much is tailor-made to handle this problem that I had, and for it to be here at Fort Knox, I mean, it was just, like I said, a blessing in disguise.
It's hard at first when you have to sell someone on the idea of talking to a TV screen as being a personal experience, but everyone's concerned about surgery. They're afraid, if you will. It's a big decision. So when you go in and you put them in a room with a TV screen and that TV screen comes on and then you watch their reaction, it's incredible because what happens is there's actually a bond that occurs. That soldier, you can see the tension melt away from their face. Often they have their family members with them, which helps, and they can ask questions. So as I said, you watch a rapport develop between that neurosurgeon and the soldier so that when they go up to Walter Reed, they've actually had a chance to meet him face to face. They've had their questions answered, and they feel confident that they're going to get the best care possible.
Many patients do have some apprehension. You can see it in their face and the way they behave. They would rather be in the same room with you. But immediately, upon asking a few questions, giving some answers, that melts away, and they feel very comfortable about it.
The video teleconference was great. It actually gave me an opportunity to see face-to-face the doctor who was going to be doing my surgery. It was really important for me because it did alleviate a lot of the fears that I had.
You know, to come out of that VTC and have that kind of knowledge and knowing that somebody knows exactly what's going on with you. And, you know, that right there gave me, I already had the ultimate confidence in the PA that was talking to me, but that even took it to an all-time high because everything she told me about the surgeon was right on point.
After the VTC was over, I thought, wow, that was a pretty painless and easy experience. If everything went so smoothly, we'd all be lucky.
I think the comment that I hear the most is soldiers often tell me that it's not so much what I know, but they want to know that I care. So they let us know. They tell us that it's important to them. They need programs like this to make them feel like their care is important. And it's not only their care while they're in active duty service, but also afterwards. We want these individuals to have a productive life after the Army just as well.
Ms. Bordoff could sit there and perform the same duties as the doctor and actually provide a better, more personable, I think a more personable service than a busy neurosurgeon. Because, you know, the neurosurgeon's job is to perform surgery. She provided, I guess, the bedside manner that a neurosurgeon doesn't have time for.
It was very comforting to know that the physician assistant that I needed to talk to had an open door policy. If I needed care, if I needed assistance, if I needed just some advice about things that I was experiencing, I could just walk to the office and be seen.
This is a dangerous job. It's a tough job. And sooner or later, regardless of all the risk mitigation and safety measures you put in place, somebody's going to get hurt. And being able to just right there on the base, walk in the door, say, hey, I have a problem, and know somebody's going to be there to take care of you, there's no better feeling.
After the video conference, there's almost a sigh of relief. The soldier usually turns and looks at you and says, I can't believe how much better I feel. They've been able to discuss personally with the neurosurgeon the options. It's usually a percentage thing, and they want to know what are my chances, and that neurosurgeon is able to tell them that. And that's the question that they've really wanted answered. And when they get that answer, then they can make their decision. My patients are usually very focused and driven, and once they make their mind up, they're ready to go.
One of the benefits of the people that I talked to is they didn't seem to push any particular treatment on me. They gave me the options and they let me decide the treatment course of action.
During the VTC, I was a little skeptical at first if they were going to do the surgery or not, and they basically left it up to me, which was a good idea. I just wanted the pain to go away.
Right away, he just introduced himself, and he had this bubbly personality, and I already knew, that okay, I can relax a little bit and ask the questions that needed to be asked.
The TNS program allows us to determine in advance whether the conservative route is the best route for that soldier before he spends the time and money in traveling up to Walter Reed to determine that. If that can be determined over teleconferencing techniques, then the treatment can be performed right on post, very convenient for the soldier, and a great reduction in cost, and both emotionally and financially.
I went for my first profile after I took a PT test when I couldn't lift my baby, when I couldn't lift my son, when he was crying, and I couldn't lift him up. That is what affects your life.
After hearing news that you can't have surgery, which was corrective at the time for most tumors, he wasn't going to have that option. That's what made it so hard. It's like, okay, so if he just grows, they were telling him all these things, but they weren't offering him options. That was most frustrating.
Yeah,
and finally, after the VTC, he was offered some options. And when he says I was done, he says he was done in the sense that he was so emotionally distraught and so drained till it's just like you just let go and he starts crying. And it's just like, okay, finally, God has answered my prayers and this thing has opened up to where somebody's going to do something.
I was ready to have half my spine removed. I mean, I was just like extreme. And she took, arranged for the MRIs and all this stuff to get taken and everything. And she looks at him and she's just like, I don't think you're going to be a surgical candidate. And I'm just like, you just took all hope of my life away from me. And then she arranges for the telemedicine. He was just like, nope, you're not a surgical candidate. He said, if I can cut on you, but I'll make you worse. But he's like, do what she tells you and you'll be better. And right about a year after my initial injury, I was better.
We take great pride in the detail that we put into determining the candidates that are going to be the best surgical candidates. We only want to operate on those individuals that are going to benefit. And so far we've been very successful at that. We have many soldiers that are back out 100%. We have soldiers that are deployed back to Iraq and are back. We have soldiers that have gone to other duty stations. It's something we're very proud of.
The amazing thing is that virtually all of our soldiers, male and female, recover quickly after surgery. As soon as they are awakened from anesthesia, they're out of bed and they're expecting to travel back home the next day. Fortunately, they have a medical attendant that will handle their bags. That could be a family member or somebody assigned from their unit. But they're usually home in their home unit within 24 hours of their surgery.
When I showed up at Walter Reed, I knew everything that was going to happen, and the surgery, as soon as the surgery was completed, I felt immediate improvement, and there was no more of the disc pain that I had been feeling, and I was able to start walking right the day after the operation in the post-op ward.
The medical care I received at Walter Reed was excellent. Everyone from the anesthesiologist to my surgeon, they were very friendly, they were very approachable, very personal, very professional.
Walter Reed, I had a good experience. Surgeries went okay. I had 3 of them all at once, and I was up out of bed the next morning. Kind of made the doctor a little bit worried because I was up running around. He got mad at me and said, "Get back into bed." But I felt good because as soon as I could come down off the medication, because I was out there in left field for a little while. But as soon as I came off that medication, I could tell an immediate difference. I was ready. I was wanting to get up and go.
Before the surgery, I was going through a lot of pain, series of not being able to get up in the morning, get out of bed, tie my shoes up, put my own clothes up. Right now, I'm fully functional. I can get up, tie my own shoes up, and I don't have the pain no more like I had before. And it's the best thing that I have done.
When a soldier is selected as a surgical candidate, he'll then fly to Walter Reed. He has a surgery and returns to post here at Fort Knox. Once he's back, it's my job to care for him. He's back in to see us for a wound check. We then put him in physical therapy, chart his progress, and get him back to work. That's really our job and our goal, is to get them better, to get them pain-free, get them back to work, doing what they love, back with their families.
Being able to do the things that I enjoy doing again, and including my job, and not having the reservations that, okay, if I put on this 30 pounds of equipment and carry a rifle all day, that I'm gonna be useless the next day because I'm in pain all day. It's just a good feeling.
It feels good to be able to be a person that has gone through this type of surgery and show others that, hey, you can get back to doing what you need to do. I understand that nerve problems of the neck is pretty common, and for someone to look at me and say, "Oh, you've had neck surgery? Oh my gosh," it feels good. And to say, yes, I'm working, yes, I'm back into physical activity. They expect me to do the things that I did before on the job. I don't have to worry about job security because of it. So yes, it's a tremendous feeling.
Post-op care here after the surgery was outstanding. I was checked on a regular basis. I was even called at home to make sure everything was all right.
Well, after the surgery and being able to deploy, it made me feel good. You kind of get into depression a little bit because you're not with your soldiers, and being able to do my job again, picked up my morale, made me even more motivated than before to lead my soldiers.
Now, after I've done the surgeries and everything, I get around better, I feel better, I can be more of a productive family member to my kids and families.
He's a very hands-on father. He's very involved with them, and they enjoy their daddy time, and they enjoy him getting down and crawling on the floor with them and having fun.
There is no more rewarding job on earth than what I do. To be able to help someone get their quality of life back is incredible. Sometimes what we do for our patients is no more than answer a question or educate them. Sometimes we tie together the loose ends. Our patients come to us in pain. Every single one walks in my door because they've had to come in. The character and the determination of a soldier is unbelievable. They will push past unsurmountable pain to do what they have to do. To be able to sit down and talk to that person, help them with what is concerning them or hurting them, and get them on the road to being pain-free again and being able to do what they want to do, is just incredible. It's the most rewarding job, as I said, you could ever have on earth.
Well, the greatest satisfaction a surgeon can get is to have a patient on whom he or she is operated on get well. And it's even better when they express it to you in the words that military people are likely to use. I don't know the reason, but I think military people tend to be more vocal and express their appreciation.
The Walter Reed Telemedicine neurosurgery program has been the most successful telemedicine program to date. Telemedicine has been around for a number of years, but this innovative use of it has just been incredibly successful. I believe that's because we take a limited resource like a neurosurgeon and link it with a broad-based population like an MTF. We're hoping in the future to expand that. It's worked very well on the posts that we're involved with now, which is Fort Knox, Fort Bragg, Quantico, and we just opened Andrews Air Force Base. So we're looking forward to growing the program, expanding it.
I highly recommend this program. Everybody I talk to, you know, they're like, oh, you've had back surgeries. I said, I've had a couple of them and I've been successful and my career was saved because of this program.
Having the surgery, it was great. It made me a better person, and I'd recommend it to anyone who has pain.
I would recommend the surgery for anybody that's having the herniated disc problem, the lower back problems, to go and actually have the surgery if it's recommended. Because for me, it helped me. I mean, tremendously, it helped me. I'm able to function like I was supposed to, like what I was years ago.
After my surgery, I came in for my first visit, first checkup, and I think it was 14 days after my surgery. And I seen my doctor in the hallway, and I walked up to her, I hobbled up to her as fast as I could, and I gave her a big old hug, and I just put my arms around her and said, thank you. Thank you for believing in me.
I'd like to thank the soldiers that participated in the video. It means so much to me that they were willing to be a part of this. And when I asked each of them to be a part, their answer to me was, you've supported me, I'm going to support you in a program that I believe in. It was so rewarding to travel out into the field and see these soldiers back to work, see their family members, watch them interact with their children and their spouses. It was incredible. I'd like to thank them for their support.